about you or yourself, or you know anybody that has received the flu shot and still got sick? Okay. Back to that one individual. You know anybody, third question, you know anybody with any type of autoimmune disorder, such as MS, Crohn's, rheumatoid arthritis, the list goes on and on. Okay. Let's go back to the cancer. That's kind of why I'm here. First of all, my name is Fazia from Charlotte, and I recently retired from hospital pharmacy. So I've got a perspective of seeing how conventional medicine works. But I see how the other side of the fence works too, what's going on with what's called integrated medicine. As a matter of fact, the hospital that I just retired from, I'd heard of them, I'm not going to try to hide it, Novant. They recently hired a physician full-time on staff as an office right inside the main hospital, and he practices what's called integrated medicine. So what his first project is at Novant, now get this is a tough project. His job is to go to every oncologist in Novant, not just in Charlotte, but Novant in Winston-Salem, in Virginia, in South Carolina, and train those oncologists to think outside the box. Stop corralling cancer patients down this same path of chemo and radiation, surgery. It has its place. He says, you have got to look at the whole patient. I heard him give a talk for this project. You've got to look at the whole patient, individual patient. And there are other things out there that can help them. These aren't the only three things. And we're going to be talking about a couple of things that can help cancer patients tonight. So I'll get back to that. But I was very excited. Right when I retired from the hospital's room, they hired him. I wish he was there when I was there. It's just not my religion. It's not a religious reason, but it's on principle. I never got sick. I worked in the ER the first few years. I did what's called medication reconciliation. We had to gather a list of medications patients are on when they come into the ER, and compile the list, put it in the system so the doctor can see what the patient's taking, both natural products and pharmaceuticals. So if that doctor writes a prescription in the emergency room, there won't be an interaction. So that was my job. Well, in the ER, you see everything. I mean, people are so sick that come in there. Some of the wildest stuff I've ever seen. So my associates were all sick. I wasn't sick. They all got the flu shot.
And it's required,
I'm
right?
going to tell you my secret. Okay, speak up.
It's required by the
Now,
hospital.
my 7th year at Novant, all of a sudden, it's required. I get fired if I don't get it. So I had to take it the last 2 years I worked there. Guess what?
That's it.
Sick. That's sick. My immune system is so balanced, and what I'm going to talk with you tonight about, that the flu shot actually upset that balance. So that's the story. Anyone know how effective the 2017 flu vaccine was?
How effective?
How effective?
It
Percentage
wasn't
wise?
very effective. I don't know the exact number, but I think it was about 47%.
The CDC website itself tells you that it was 40% effective. 4 out of 10 people. Okay? One of the strains, which is the influenza A, H2N13, something like that, it was only 25% effective against that strain. The effectiveness of the flu shot is determined by how closely the vaccine matches the strain that's going around your community. If there's not a match there, you're just wasting time. This is on the CDC website. You can go on the CDC and see these percentages. It'll break it down each strain, how effective it was for that strain. So that's all I'm going to talk about the flu shot. Autoimmune conditions. Prevalent, becoming more and more prevalent. Why is that? Whole key in a nutshell, without getting into detail in the specific ones. When your immune system is overactive, when it gets out of balance, it starts attacking, it's called non-self, things that shouldn't be attacking. In the case of rheumatoid arthritis, it's attacking the joints. In the case of MS, it's attacking the sheath around your neurons in your brain, which is why you get the symptoms. Turn that volume down on that immune system, stop it from being so overactive, you can begin to alleviate some of those symptoms. And I'm not saying cure it, but certainly make your life more pleasant. So, how I got interested in all this, I went to UNC Charlotte, graduated back in the 70s with Tim. We're old men. Get this, we actually went there when their basketball team was good. Their basketball team went to the Final Four when Tim and I went there.
Oh, wow.
Their basketball team is nowhere.
That's been many years.
Many years. So I was in pre-med and decided about midway through my college career, medicine wasn't going to be for me because my aptitude in chemistry was not good enough. My grades in chemistry just were not going to get me in med school. I was fine with the other sciences, but not chemistry. So I shifted gears. I graduated, went into the business world, ended up going to work for a pharmaceutical company, and actually introduced a drug that cancer patients take to this day. I introduced the Charlotte physicians to a drug that controls nausea in cancer patients called metoclopramide. You might know it as Reglan. Anyone heard of Reglan? I'm the guy that introduced that to the doctors here when it first came to the United States. So I know that side, the conventional side. And what I saw happening in pharmaceuticals is people, they went to the doctor and they felt cheated if they didn't get a prescription. They had to get a prescription. And that prescription maybe helped their symptoms, but it certainly wasn't getting to the root cause of what was causing their health problem. And the doctor wasn't delving into their history enough. And that's why I got attracted to this field of integrative medicine, where it looks at, hey, prescriptions have their place, but you can also do a lot of good for the patient by looking at the whole picture. Hey, there might be something they can do naturally that will go along with this prescription medication. I had to let the doctors know what medications patients were on in the ER when they came in the ER, and a lot of patients were on something called coenzyme Q10. I'm sure a lot of people have heard of that. Some cardiologists actually put their patients on CoQ10. When I worked in retail pharmacy in Asheville, there was a cardiology clinic in Asheville that sent patients into the pharmacy to get their prescription of Lipitor and Pravachol and Crestor, all the statin drugs, filled. They had another piece of paper in their hand. They said, oh yeah, I want to get this filled too. Guess what this was? Coenzyme Q10. The doctors up there believe in it so much. So physicians want to know what patients are taking. So they all often work together. And those patients, I guarantee you, those two happen to work very well together because the statins do reduce CoQ10. Supplementing with CoQ10 a lot of times alleviate that muscle pain that patients that are on statins get. They get this muscle pain. And the pharmaceutical reps go into the doctor and say, Doc, Crestor only causes this muscle pain in 10% of the patients. 1 out of 10. Guess what? It's more like 50%. They just don't have it on up. 9 out of 10 people don't even have a problem. So it's kind of a game there. But, all right. Here's the thing that really got me interested in this field of integrative medicine. The second year I was with Novant, there was an oncologist, Dr. John Powder, he's right here in Huntersville. And he does a lot of research into cancer. Because he's not your typical chemo radiation guy. He thinks outside the box. And he was the keynote speaker at this luncheon. Listen closely what I'm going to tell you, what he said. This is 2011, he said this. He said, Right now, as I speak, there are 900 cancer drugs in the pipeline in various stages of clinical trial, trying to get approved. All these companies trying to get these cancer drugs approved. You would just assume that most of those 900 were chemo drugs. Because chemo's big business. Guess what percentage of those drugs were chemo related? 5%. Only 45 of the 900 drugs were chemo. What in the heck with the other 95% of the drugs? What kind of drugs were they? He said they're either targeted cancer drugs. Anybody heard of a drug called Avastin for breast cancer? Avastin. That's a targeted cancer drug. The other ones were what are called immunotherapy drugs. Drugs that deal with the immune system. The light goes on. Wow, drug companies are actually recognizing that the immune system can fight cancer. It ain't just chemo and radiation. So that field of research is called immunotherapy. It started around 2010. Drug companies started trying to get drugs to the market. And finally, a few have hit the market. You've probably seen ads for one called Opdivo from Bristol Myers. There's one called Keytruda. Okay, you've seen ads for these. These drugs go in and work with your immune system. And then your immune system does its job. See, anyone that gets cancer, what has happened, your immune system has misfired. I'm standing here, I've got cancer going on somewhere in my body, but my immune system's good enough to keep it in check, so I don't have any symptoms. Tim's got it, Sunshine's got it. But she does some very healthy things. The way she eats, she's going to show you a demonstration at the end of this of a soup for your immune system that'll blow your mind. And because she eats that 2 or 3 times a week, her immune system can handle any cancer that she may have underlying. So your immune system is misfired when you have cancer. You've got to get that immune system, you've got to give it some ammunition. That's what immunotherapy is doing. It just so happened, way back before I even started working in the hospital pharmacy, I knew about a little tiny company that was doing research on what's called a natural immunotherapy agent. And the name of that is what we'll talk a little bit about tonight. It's called transfer factor. And you've got a sheet in front of you that gives you a little information. What happened was in 1949, the head of immunology at New York University, Dr. Sherwood Lawrence, was working on tuberculosis. And he took an extract from human white blood cells. White blood cells are part of your immune system. And he found out that he could take that extract from a TB patient and inject it into someone that had never had tuberculosis. Guess what? It transferred that immune knowledge from the TB patient into the non-sensitized recipient. He didn't know what it was. He didn't know what to call it, so he just called it the transfer factor because it was transferring information. That's all he could come up with. But what happened was it was only available as an injection of white blood cells, so very few doctors knew about it or used it. And it's pretty expensive too. It was discovered about the same time antibiotics were just coming into vogue. You know, penicillin was a miracle drug. The antibiotic here it comes. So this transfer factor information kind of got shoved under the carpet. In 1998, it resurfaced, and the CEO of our company, Tim and I are with this company, For Life Research, discovered a patent for an extraction process where you can get this transfer factor from a natural source. You didn't have to get it from white blood cells. You can get it from, guess where? Colostrum, the first mother's milk. Who's ever heard that babies that breastfeed are healthier than babies that don't? Guess why? In those first few days after birth, when they're breastfeeding, they're getting the first mother's milk, it's very high in this transfer factor. mother's transferring that to the baby. That's building the foundation of the baby's immune system. So they got this process of extracting it from colostrum, concentrating it, filtering it. David Lisby got the patent for this. No other company can do this in the world. This is the only company in the world. Drug companies that tried to buy these guys out, they turned it down. So they don't want to go through the millions. You know, would have to go through the FDA trials, and that's millions of dollars. They're doing fine. You know, I mean, they're not huge. They sell maybe 400 or 500 million a year. It's good. So, sorry, up it there. All right, so, you guys all live in Kannapolis? Concord, this area? You familiar with what's going on at the research campus here? Downtown Kannapolis, the old Canyon Village?
What they were doing pineapple.
It's not just pineapples. It's not just pineapples. Let me tell you, Mr. Gold, Mr. Gold, we gotta call him Mr. Gold. Mr. Murdoch, he has got a study going now, right here in Kannapolis. $35 million he put with his own money. There's 12,000 people in Kannapolis participating in this study. And guess what they're studying? Immunotherapy, targeted nutrition. What nutrients, what components of plants, what things in lemongrass, what things in turmeric, curcumin. What's in there that's helping cancer patients so much? They're studying it. They're trying to find, how's it work? How does this work? Here's one way this works. Transfer factor. You've got components. You've got different types of cells in your immune system. Your immune system is very complex. It's very smart too. Two of the main types of cells in the immune system, one is called IgA, which is immunoglobulin A. One is called NK cells. Those are natural killer cells. Okay, that's the only two I'm going to talk about tonight. I mean, you could get into a lot of different types of immune cells. What IgA is, that's your first line of defense. IgA is in your saliva, in your mucosal membranes. When you breathe in a pathogen, a lot of times that's the first point of entry, through your nasal passages. When you take transfer factor, they've done a study on this, multiple studies. It increases IgA antibodies in your mucosal membranes 73% on average. 73%. Just by taking that thing. They tested patients after 2 weeks. So it's not like we're going to let you taste this. This has 600 milligrams of transfer factor in it. It's a fruit, pomegranate, acai, and transfer factor. We're going to let you taste that at the end. But you're not going to drink that and have a 73% increase tonight. But after 2 weeks, that's going to be the average increase. So keep in mind, nutrients are not like taking a pharmaceutical where you get a result usually right away. Nutrients take a little time. You develop conditions in your body over a period of years. So it takes some time to build it up with proper nutrition. This is the type of stuff they're studying right here on the research campus. It's fascinating. Tim's been taking classes over there, and he's met some people over there on the research campus. It's amazing what's going on over there. It really is.
Truly is. Kannapolis should be proud.
Yeah.
Only Kannapolis is known first because they have a group meeting in here. Mr. Murdoch, he's trying to put in small town like us, learn about the technique and use nutrition food like we have cooking today. Mr. Murdoch has been in Thailand to many years, and because he had 2 wives. First wife died cancer, second wife died cancer. So that's why he opened a class and research in Kannapolis.
That's why he's so fascinated with what foods can prevent this from happening. He lost 2 wives. There's got to be some answers out there, and sure, the answers are in nature. I I didn't get into the NK. This is 73% the IgA antibodies. NK cells are a component of white blood cells. There's something called lymphocytes. A type of lymphocyte is NK cell. That stands for natural killer cells. What these do is they kill viruses, bacteria, cancer cells. So it's amazing to me that oncologists don't talk about this when they're dealing with a cancer patient, because you definitely want your NK cell activity to be heightened when you're dealing with cancer, because they attack cancer cells. I mean, wouldn't you think a doctor might say, okay, here's something we can do? So guess what? Pharmaceutical companies have come up with drugs that affect NK cells. One of the most famous drugs that raise NK cell activity in your immune system is called interleukin 2, IL-2. Okay, $6,000 per injection. $6,000, and it does a good job. It raises NK cell activity in this particular study 389% over baseline. That's pretty good. It might be worth $6,000 if you've got the money. Okay? So besides the price, let me read you, and there's never been a drug invented, I learned this in pharmaceutical days, that does not have side effects. All have side effects. Side effects of IL-2. This happens in greater than 30% of the patients. Now that's a high percentage. When I worked for my drug company, they said 10% was high. 10%. 30. 1 in 3 people are going to get some of these side effects. Fever and chills, flu-like symptoms, generalized flushing of the face and body, skin rash, nausea, vomiting, lowering blood pressure, and diarrhea. That's the side effects of your $6,000 injection. But you've done a good job here. So you might want to live with those side effects, right? Okay.
How long do they last?
Well, different in different people. Okay. So the CEO of For Life Research sanctioned a study and said, let's test our little natural product here, transfer factor, just to see. I mean, I know it's not going to be a $6,000 drug, but let's just see. They did a really comprehensive test in a hospital in Russia. Couldn't do it in the United States because the FDA would be all over it. You can't do that. You can't do that. The FDA is pretty tough here. So they tested this against IL-2. And guess what happened? Transfer factor actually raised it 437%. Both very high. This one's about $50 with no side effects. $6,000 with all those side effects I just read. Quite a difference. So that was an impressive study. This came out in 2004 as part of a real exhaustive, it's real technical. Transfer factor use in immunorehabilitation after infectious, inflammatory, and somatic disease. It's very technical. I can't even understand this stuff. But they do reference this study in there. And by the way, the cancer patients in this study that talk about, they still did chemo. A lot of these cancer patients, but they took this as what's called an adjunct, right along with chemo. All those side effects that you normally get with chemo were lessened. So the chemo was a better experience and actually worked better in patients that were taking this with chemo. So there are some that are doing it in lieu of chemo, but a lot of people take it. A lot of my clients in Charlotte actually take this with chemo. It's a lot more pleasant experience. I was hoping Phyllis McClure would come and bring her son tonight. She's in Concord. But he actually went through radiation, but refused chemo, and just did this. And he's doing fabulous. The doctor said, whatever you're doing, you know. She tried to show him some stuff. He said, no, don't do it. I don't, just keep doing it. That's what he said. See, they don't want to get involved because it's not under the pharmaceutical protocol. But they know it's helping. They say, keep doing it. so I was hoping she'd come and tell her story tonight. All right. Now, the key thing I want you to take away tonight. Oh, I did want to, for that, I do want to mention that the Nobel Prize in Medicine, this, for 2018, was given to 2 scientists, one from Japan and one from the U.S. This is a little blurb from the New York Times. Guess what the research was in? Immunotherapy. Helping the immune system fight cancer. They won the Nobel Prize. So this field is getting so big, there are pharmaceutical companies coming out of the woodwork trying to develop immunotherapy drugs. They've abandoned chemo. And that's amazing because chemo is a big business for pharmaceutical companies, but they realize it has so many shortcomings. They say, we're just not going to put more money into that. It's just, we need to move into a new realm that really helps patients fight cancer. But here's the main thing. Let's go back to that autoimmune thing I talked about at the very beginning. When your immune system gets out of balance and starts attacking other organs, you get all these autoimmune conditions. Rheumatoid arthritis is a big Crohn's. The guy I know in California has an amazing Crohn's turnaround with this product. In fact, his story is known all over the world. Just the turnaround he had. And this is the only thing he did different. And what it did is it calmed his immune system down. It was attacking his GI system. And it modulated that immune system. And now the body's just doing the rest. It's not that this healed it. It just calmed his immune system down. The immune system did the rest. What they did here, T cells become overactive when you have an autoimmune condition. And in this study, they injected different substances that will make T cells go haywire and start attacking. Let's see some of the stuff. Effervescent immune tablet, echinacea, bovine colostrum. You see T cell activity increased. But these smaller ones down here, when they gave transfer package, picture the volume of the speakers being up to 10. Transfer factor goes in, turns that volume down to 5. Gets an imbalance. That's all it's doing. So what's so unique about this transfer factor is it not only raises your immune system, like in the NK cell activity we talked about, it actually turns down the volume if it needs to be turned down. It's like a thermostat for your immune system. It's like the brains of your immune system. And that's what's just so fascinating about it. And that's why I've taken it now for about 18 years. Tim's probably on and off for maybe 10 years.
On and off.
But I want him to tell you something that happened to him a few years ago. About 6 years ago, 4Life developed a line of products called targeted transfer factors. And what these do is they target specific parts of your body, like the brain, the heart, a metabolic one for diabetics. Tim got turned on to the heart product because of something that happened to him, and I want him to tell you his story, if he doesn't mind.
Okay.
I'll try to be brief, okay? Actually, Steve, it goes back. Before I went to South Carolina, I was in South Carolina 14 years, and I started using this transfer factor cardio product. This product is designed to target inflammation in the body. I was at Whole Foods. You don't remember this, but we were at Whole Foods, and Charles Fireball ran into you in the parking lot. I hadn't seen Steve for a while. He told me, he said, I told him, I've got to go get my blood checked. You know, I have a lipid profile. He said, well, if you do that, you need to have your CRP level checked. I said, Steve, what's CRP? What's CRP? He said, that stands for C-reactive protein. Well, I'd never heard of it. So I went and studied a little bit. And so he said, tell your doctor you need to have it studied. So I said, okay. And all it is when they draw your blood, do a lipid panel, check your CRP through that blood draw, okay? So I went to my doctor and I told him, I said, well, we're gonna draw blood. I said, I want you to check my CRP level. And I said, okay. He said, okay, so we usually don't do that. But now this was, keep in mind, this was probably 16 years ago, okay? 17 years ago. But he said, we don't typically do that, but if you want us to, we will. So I thought, well, I'll just let it go. And they do it. And on my way out the door, he said, well, if you decide you want to have a CRP level test check, come by, call us, and we'll draw the blood. Come back by. So I got home and thought about it a little bit. I thought, you know, I really want to know. Steve had given me half a bottle of this. And so I went back to the doctor and I said, I want you to check my CRP level. So they did. And about 4 days later, you know how that is, they call you up to give you results. Well, it wasn't the nurse that called me, it was the doctor that called me. He said, Tim, got your CRP test back. He said on a scale of 1 to 4, with 4 being the worst, you're 7. And I said, uh-oh, we got a problem, you know. And he said, you need to get on a statin drug right away. He said, statin drugs will probably help you. Okay, so I said, okay, so I called in, went and got the statin drug, sitting at my desk in my office. I work from home, and I had this sitting on my desk. And I thought, well, what are you going to do? You got a problem. Well, let's hit it with everything we can. So I used this along with the statin drug, okay? Then, for about, I guess, maybe a year or 2 years, and then I went down to South Carolina to work with a friend of mine. I was contacting Steve on a regular basis, as we had been, and came off the cardio product. A year and a half later, I'm laying in the hospital with a heart attack at age 51. So I got thinking about things. Got back on the CRP level. Got on this product. Well, before, let me back up. Before I had a heart attack, went to South Carolina. I used this product along with the statin drug. And what about checking the medical records? That was actually in
Brothers of the cardiologist in Rowan. That was hard to see. And he was telling me the conferences he attends each year, the cardiology conferences, that was the hottest topic. In arterial inflammation, C-reactive protein, and something that's called high sensitivity C-reactive protein. That's more specific to cardiovascular inflammation. So that's the test you should actually ask for if you have heart disease. Ask your doctor, can you do an HSCRP test? And some insurance companies do cover it. Mine did. My doctor said, oh, we don't normally do that, but yeah, we'll do it. And it would cover it. So I think it's the more, we've got a 10-year track record of the CRP issue now, so now more countries are going to charge. I'm going to wrap it up by just showing you the forms that the product comes in. It comes in a number of different forms. Also, invariably when I do a talk, a lot of people in the audience will the next week go to their doctor and say, Doc, you heard of this transfer factor? Should I take it? The doctor probably doesn't know about it. But if you want to have some fun with your doctor, I will tell you, it is listed in the physician's test reference. And I brought an old, when it first came out, it was only in the supplement to the physician's test reference, which is just for dietary supplements. So, you know, and over-the-counter items. So you see things like Ecotrin, Abreva, Trident gum, you know, all that halls. There it is. The cardio that Tim just talked about, and the Transfer Factor Plus, which is the one cancer patients use. All right. Now it's in the big blue book that's in your physician's office, a huge PDR with all the drugs. So you can say, Doc, don't take my word for it. Look in your book. You can read all about it. His studies in there. So he still might not recommend it because he still hadn't studied it enough. But a couple of them are coming around. A couple in Charlotte are starting to pay attention. I said, man, there's something to this stuff. The forms it comes in a basic capsule, chewable. I don't have any in here. It's an empty bottle. That's the form I prefer. The Transfer Factor chewable. spray. This is one of my favorite. I don't go anywhere without this. That is like my American Express card. There are nurses at Novant and Carolinas Medical Center. Carry this around with them when they go into a patient's room. It's got, I mean, there's a lot of antibiotic resistant patients in the hospital. There's, some of those rooms you got to get suited up, but they'll spray this before they go in the room and after they come out. It has not a high dose of transfer factor. It only has 60 milligrams, but it has something called colloidal silver in there too, which is a natural antibiotic, antiviral. This is a powerful product. I do not go anywhere without this. I freak out when I run out of this. I mean, this is low right now, but and that's one way I stayed healthy in the emergency room. I didn't get sick. I mean, people say, "What are you spraying?" That's my secret. That's my secret. That's why I don't get sick. And they would just, "What are you doing?" So the spray is a wonderful product. It comes in orange and mint.
What does it sell for?
It's about $22.
How often do you use it?
Just as needed. Just,
Like one in the evening?
I mean, there's some days I don't use it at all. There are some days I just feel like, maybe I feel like a scratchy throat coming on. That's how I've tested it on people. A pharmacist I've worked with when I was in retail, they say they're getting a sore throat. They can feel it coming on. This doesn't work like a chloroseptic that would deaden it. So I'd let them spray my bottle. They sprayed it. Say, yeah, I'm done. See you later. 20 minutes, 30 minutes later, invariably, they go, Steve, what's this? It's gone.
Wow.
And it didn't deaden it. It has this systemic effect of the transfer factor, but it has that colloidal silver going right on the affected area. This stuff's powerful. There's a chiropractor in Charlotte. When I pull up into his parking lot, they say, "You got any spray?" Whatever spray I've got in my car, he takes every one of them. One time he bought a dozen. He works with a lot of kids. There's a pediatrician in Maine. So get this. He has a huge practice, 1,000 kids. He sat down with the parents of 200 of these kids. He says, "Listen, I want to do a little study in my practice. Your kid is in here every 6 weeks with an ear infection. We put them on an antibiotic, and it might work a little bit. They're back in here 6 weeks, 8 weeks later, got another ear infection. It's just not working. It's just like an antibiotic merry-go-round. Let's try something different. Let's work with their immune system." He got the company to make a non-flavored spray. Just neutral, not mint or orange. Sprays it right in the kids' ears. He reduced his the antibiotic use in that practice 78%. Reduction of antibiotic use. These kids is amazing. And he wrote it, he didn't publish it in a medical journal, but he did a retrospective study that he wrote up and he made it available to lay people. He says, "I can't put it in a regular journal because the FDA they just won't have it because I didn't follow all the protocol. I just know it helped my kids." And the parents are thrilled. And now they start talking to other parents. Now they're like 400 or 500 kids. He's going to wipe out his practice. They're not going to bring the kids there anymore. What's the other? Oh, and the sticks. We're going to let you taste this one tonight. They developed this about 5 years ago. 600 milligrams of transfer factor in a stick, like Crystal Light, in a base of acai, pomegranate, and blueberry. Just mix it up in water, and we're going to let you taste it. It's fabulous. It's really cool. Electrolytes, too. Electrolytes. Oh, tell them about your son when he got sick.
Yeah. Sanded, my son, 16 years old. He's in Northwest High School. He plays soccer a lot. Yeah. He plays at the club soccer for UNC Charlotte, and he plays for the school. Rain, not rain, he's still there in the field. One day